Welcome back to the United States. Uh, let's just say welcome back to Caribou Data Science Channel. Today is October 14th, 2020. I'm just getting ready run the report for the United States, the COVID-19 report, my daily report. I'm just going to crank this baby up and see exactly how the numbers are looking in the U.S. There is a link with the code and the data in the description below. And also, before we begin, don't forget to subscribe to the Caribou Data Science Channel. It's very easy. Just click the red button, red S, down the bottom right-hand corner of your screen. Also, don't forget to click the bell next to the subscribe button so we can be immediately notified when I update my latest report and COVID-19 data. Okay, that's good. That's good on the roll here. The current average number of cases per day, 29,316. The current number of deaths per day is, say, 939. Now, if we look at the mortality rate since the very beginning, we see that if this is 10, this is 5, this is, say, 3.5% mortality rate average. Well, we can see that from about here on, the mortality rate is either stayed at 3.5 or below 3.5, which means that which is interesting considering that we'll see that cases are spiking and deaths are actually decreasing. Okay. So anyway, here is the current daily pattern, current daily number here. The blue line just gives us sort of the underlying trend of the data, which is trending upward. We've already had 2 spikes. We're heading for a third. That's hard to say. The gray line is the incubation period, which according to Washington University Institute for Health Metrics and Education, is 17 to 21 days. So what this tells us is, and the chart is moving to the left, okay, sliding to the left each day. So to the right of this day, these are the dates year to come, are the dates yet to come. To the left of the bar here, are the dates that's already passed, meaning that the deaths associated with these numbers over here should have already occurred. Okay. Now let's look at the deaths by day. The trend is obvious. A huge decline here back in April, a slight speed bump here. Now it's resuming its decline. Okay, so currently, if this is 500, okay, and this is 1,000. Well, this is about 750, 800 deaths. So we're ranging between 500 and 1,000 deaths right now per day. Let's zoom in a little bit on the cases and narrow down to June. You can see once again here is that incubation period, 17 to 21 day incubation period. These dates haven't been reckoned with yet; they haven't occurred. But again, all these dates here to the left of this line should have already been taken into account. We should already have those deaths recorded. Okay, but here you can see, we zoom in, you can see that the deaths are declining. On average, the daily number of deaths are declining. If you look at it by week, the red line again is the average cases per week. You can see that in cases we're not doing particularly good. You can see that the spike in cases was much larger than back in April and May. Okay, all this here is a spike. Yet if we look at the deaths have been below that number all the way over to here. As a matter of fact, the deaths have been declining since July. We come to here, straight down to here. All these deaths. Okay. All these deaths will fall underneath this line. All right? Decline here, 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 weeks of decline. This is a little more even, but nonetheless, it's still decline below this number here. Take a look at monthly data. You can see again that the cases have even declined on a monthly basis. On a daily basis, they're increasing, but on a monthly basis, they're declining. Okay? Deaths, you can see, declined again in September. Here's the big spike. Draw a line down to here. All these months fall underneath this line here. So overall, I would say that the U.S. is doing extremely well in deaths. Cases, we'll get that under control eventually. But deaths, as long as deaths remain low, then that's really what it's all about. Because according to Johns Hopkins University, Institute of Health Metrics and Education, according to Washington University, Institute of Health Metrics and Evaluation, uh, the single most important factor is death, and not cases, which is what some people try to convince you. The only thing that matters is death. Okay? So that takes care of the report for the U.S. for today. I hope that report was both encouraging to you and also I hope it was encouraging you to keep the fight up. So anyway, as you can see, so the good news is that deaths are continuing to decline. Okay, that's the very good news, and that means that the sacrifices you and me are making, wearing masks, avoiding social distancing, of practicing, avoiding whenever possible crowds, is having a positive effect on the deaths because the deaths have been declining since mid-July. Okay, thanks so much for your time today, and we'll catch you on the next report.